Hi, this is Michael Jordan, President of our Labor and Strategic Accounts Division of HealthCare, joining you here today from our Tinton Falls office to discuss public and private exchanges. With the ACA that went through earlier in the year, there was a lot of activity around both public and private exchanges. A lot of discussion, a lot of confusion. A lot of people on the street that I spoke with didn't understand the difference between the two. Today, we're going to actually cover some of the benefits and features of public and private exchanges, some of the differences and qualities that come with both of those platforms, and what they mean ultimately to the consumer. So to start, the public and private exchanges, what they have in common, they're both web-based. So the internet will serve as the medium for gaining information and insight on the programs out there. They both have decision support tools. So they allow you to search on networks. They allow you to do some pricing, look at different programs, and see what makes the most sense for you and your family. And lastly, they have plan comparisons. So you can actually look at the different metal tiers if, say, you're on a public exchange, or if you're on a private exchange, you can look at the defined contribution policy or strategy behind them. So let's first look at public exchanges. What defines a public exchange? It's a government-run program. Now, this could be done one of two ways. It could be done on a federal basis, or it could be done on a state basis. We're in New Jersey today. New Jersey took on a federal platform where the feds are actually running the programs through the insurance companies for consumers and or small groups that are enrolling in those programs. Whereas across the river in New York, those programs are actually run by the state. So the state department in New York State actually ran that program, put together the pricing, all the insurance companies, and all the features that followed that. They all have essential benefits. So there are some mandated benefits that must be covered, i.e. hospitalization, ER, maternity, and all those things must be covered at a specific level. Metal tiers. So on the public exchange, you have bronze, platinum, silver, gold, and a catastrophic plan. So in essence, you have stratified certain metal tiers of coverage that must be offered on a public exchange. Lastly, you get a subsidy or tax break. So many of the individuals and groups that enrolled in those programs were actually eligible for some type of tax break or subsidy. Now we're going to move on to a private exchange and what differentiates that. So a private exchange is either an employer, carrier, or consultant sponsored program. So unlike a government program, there's going to be a lot more flexibility. You don't have metal tiers. So you have a lot of flexibility in terms of different plan designs. So they're not going to fall within a 60, 70, or 80% coverage level per se. They're not going to be defined benefits. So there's going to be no benefits that are actually mandated or following essential health benefits. So there's going to be a lot of flexibility. Lastly, there's going to be what's called a defined contribution strategy. In the large employer market, we believe private exchanges are going to be a very important part of the marketplace as we move forward, since they will be offering ultimately the most choice, and employees will then pick a plan based on a defined contribution and in essence go shopping for a different type of program. Thank you.